Most patients choose their breast augmentation incision based on the scar. That's the wrong thing to focus on. Because the real difference isn't where the incision is, it's how the surgery is performed. I'm Dr. Shim Ching, board-certified plastic surgeon. Today, I want to explain why the armpit incision, when done properly, can be a very safe and a very effective option for breast augmentation, despite the strong opinions you may hear otherwise. What most patients don't realize is this. There aren't just different incision locations, there are two completely different ways to perform an armpit incision. And that difference matters more than almost anything else. The first approach is often called a blind or blunt technique. The incision is made in the armpit and the implant pocket is created without direct visualization of the anatomy. Tissue is separated using instruments, but the surgeon isn't actually seeing the structures as a pocket is formed. That lack of visualization limits precision. The second method is an endoscopic technique. And that's the approach that I use. A small camera is placed into the surgical area, allowing us to see the anatomy clearly and in real time. That visibility changes everything. When you can see exactly what you're doing, you can be precise. You can identify blood vessels accurately. You can respect muscle boundaries. You can customize the implant pocket to each patient's anatomy instead of relying on estimation. Every patient is different. Blood vessels don't follow the same path in every body. Muscle thickness varies, tissue planes vary. When surgery is performed without visualization, precision becomes limited. And precision is one of the most important factors in both safety and long-term outcomes. One of the biggest advantages of the fully visualized endoscopic approach is bleeding control. Modern surgery isn't about speed, it's all about control. And we can see every vessel, we can control bleeding as it happens. That matters well beyond the operating room. Less bleeding usually means less bruising, less swelling, less discomfort, and a smoother recovery overall. But bleeding control matters for another critical reason: capsular contracture. Capsular contracture occurs when scar tissue around an implant becomes firm or tight. While we don't know every cause, two factors consistently increase in this: blood around the implant and bacterial exposure. Studies show that blood in the implant pocket increases excessive scar formation. So when bleeding is controlled precisely, the implant environment stays cleaner and more stable, which helps reduce the risk. Most surgical bacteria live on the skin. With incisions placed directly on the breast or around the areola, the implant is physically very close to skin bacteria. With areolar incisions, there's an added issue. Milk ducts naturally contain bacteria. When implant passes through that area, exposure can occur even without visible infection. That exposure has been linked to higher rates of capsular contracture. With an armpit incision, there's a greater physical distance between the skin incision and the implant pocket. That separation helps reduce bacterial exposure. When combined with an endoscopic technique, it allows for precise pocket creation, careful bleeding control, and accurate implant positioning, all while maintaining a cleaner implant environment. Incision location alone does not make surgery safe or unsafe. Technique matters. Visualization matters. Surgeon experience matters. If your surgeon offers an armpit incision, the most important question to ask is not where the scar will be, it's how the surgery is performed. Are they using direct visualization? Are they controlling bleeding precisely? Are they tailoring the pocket to your anatomy? Breast augmentation should never be about shortcuts. It should be about planning, precision, and long-term results. If you found this explanation helpful, please like the video and subscribe. I share educational content like this to help patients make informed, confident decisions about their care.